Hello and namaste everyone. Today we are going to talk about the inferior view of skull, which is also called in Latin Norma basalis. This video is covered in two parts. This is part 1, Norma basalis. The anatomy of the cranium in this view is quite complex. For the proper visualization from this view, we have removed mandible. This view, that is Norma basalis, extends antero-posteriorly from upper incisor teeth to superior nuchal lines. It extends laterally along the zygomatic arches, their posterior root, and the mastoid process. The zygomatic arch present on anterolateral aspect of this view shows lateral convexity, and inferior part acts as a site of origin of masseter. For descriptive purposes, Norma basalis is divided into three parts: the anterior, middle, and posterior. The posterior limit of the hard palate is considered the junction between the anterior and middle parts. Similarly, the middle and posterior parts are separated by an imaginary transverse line passing through anterior margin of the foramen magnum. This part encompasses the superior alveolar arch and the bony hard palate. The superior alveolar arch is the curved border formed by the alveolar processes of the maxilla, and it bears 16 inferior projecting alveolar sockets. These sockets house the upper denture. The joint between the tooth and the socket is gomphosis type of fibrous joint. The bony hard palate present within the superior alveolar arch is formed by the palatine process of the maxilla on the anterior 2/3 aspect and the horizontal plate of palatine bone on the posterior 1/3 aspect. These parts meet at a cruciform suture formed by the intermaxillary, which is also known as median palatine suture, interpalatine suture, and palatomaxillary suture. The palatomaxillary suture, which is also known as transverse palatine suture, is usually in the line of second molar tooth. The palate separates oral cavity from the nasal cavity, and it has an important role during articulation and deglutition. Posterior continuation of the hard palate is made up of muscles and is known as soft palate, which is responsible for closing of the nasal cavity during deglutition. An incisive fossa is present anteriorly in the median aspect of the palate, just behind the central incisors. On the lateral wall of the incisive fossa, lateral incisive foramina are present, which act as passageway for ascending terminal rami of greater palatine artery and descending nasopalatine or sphenopalatine nerve. The lateral incisive foramina communicate with the nasal cavity via incisive canals, which are also known as nasopalatine canal. The upper opening of the incisive or nasopalatine canal is also known as foramina of Stenson. Sometimes a median incisive foramen may be present, and when present, the median incisive foramina is responsible for transmitting right and left nasopalatine nerves. For procedures involving the hard palate, incisive fossa acts as a site of injection of local anesthetic agents. During intrauterine life, the palate develops from the primary palate and the secondary palate. Primary palate is derived from intermaxillary segment and secondary palate is derived from maxillary processes. The incisive fossa acts as a meeting point of primary and secondary palates, and if there is problem with fusion of these palates, we may observe cleft unilateral or bilateral cleft involving the lip and jaw. Behind palatomaxillary suture, at the posterolateral aspect, medial to the third molar, is the presence of greater palatine foramen, through which greater palatine nerve and vessels traverse. In a groove which leads forward from greater palatine foramina, greater palatine artery travels anteriorly along with the greater palatine nerve. The artery supplies the hard palate and gingivae of upper denture and finally enters the previously mentioned incisive or nasopalatine canal. A couple of lesser palatine foramen are present behind greater palatine foramen. They contain lesser palatine nerve and vessels. The palatine crests, which give attachment to the tendon of tensor palatini, extend medially from the posterior aspect of the greater palatine foramen. Posterior border of the palate is the site of insertion of palatine aponeurosis. The posterior border projects in the midline as posterior nasal spine, which gives attachment to the musculae uvulae of soft palate. The palatine bone articulates with vomer on posterior aspect and with sphenoid on lateral aspect. The middle part can be dealt more easily if we divide it into two areas, that is the area present in the midline and the right and left lateral areas. Let's talk about the midline area of the middle part of Norma basalis. In this area, we encounter the posterior border of vomer separating the two posterior nasal apertures, which are known as choanae. Inferior margin of the vomer articulates with the hard palate, while the superior margin has splitted into two alae, which articulates with the rostrum of the sphenoid, forming skin dialysis type of suture. Beyond the choanae, a broad bar of bone slanting down to foramen magnum is present, which is formed by the union of basis sphenoid and the basi occiput. This sloping bone forms the roof of the nasopharynx and is related to pharyngeal tonsil. On this bar of bone in front of foramen magnum, a small midline pharyngeal tubercle is present, which is the highest point of attachment of superior constrictor of pharynx. Pharyngeal tubercle also marks the posterior boundary of nasopharynx at the base of skull. Let's talk about the lateral area of middle part of Norma basalis. Descending behind third molar tooth from the junction of sphenoid greater wing and its body, on each side are the pterygoid processes. Each process consists of a medial and a lateral pterygoid plate, which have free posterior margin. These plates, the medial and lateral pterygoid plate, are separated from each other by a posterolateral facing pterygoid fossa. Two muscles are contained within pterygoid fossa: the medial pterygoid and tensor veli palati. Laterally, the processes are separated from posterior maxillary surface by pterygomaxillary fissure. The medial pterygoid plate forms the posteriormost part of lateral wall of nose. The medial and lateral surfaces of medial pterygoid plate are related to choanae and pterygoid fossa respectively. Free posterior margin of medial pterygoid plate is related to cartilaginous part of eustachian tube on its superior aspect. The posterior margin also serves as site of attachment of pharyngobasilar fascia, and at the lower aspect, site of origin of superior constrictor. The tendon of tensor palati winds around a prominent hook-like process known as pterygoid hamulus, which is present at the lower end of posterior margin of medial pterygoid plate. Pterygomandibular raphe is a tendinous band of buccopharyngeal fascia. It has its superior attachment at pterygoid hamulus. The raphe gives attachment to buccinator anteriorly and superior constrictor of pharynx posteriorly. Upper end of posterior margin of medial pterygoid plate, it splits into two edges which pass posteriorly and laterally enclosing a scaphoid fossa, which is the site of origin of tensor palati. In the roof of the nose, medial pterygoid plate has a small median projection which is known as the vaginal process. The vaginal process of medial pterygoid of sphenoid articulates with ala of vomer superiorly and sphenoidal process of palatine bone inferiorly. A small palatovaginal canal is present between these processes, which is a passageway of pharyngeal branches of maxillary nerve and artery. There is also presence of vomerovaginal canal. The lateral pterygoid plate is a thin bony plate which extends posteriorly and laterally. It forms the medial wall of the infratemporal fossa. Lateral pterygoid plate acts as a site of origin of couple of muscles of mastication. The medial surface gives origin to deep head of medial pterygoid, whereas the lateral surface gives origin to lower head of lateral pterygoid. Lateral pterygoid is the only depressor of temporomandibular joint. The infratemporal fossa, also known as parapharyngeal fossa, is an irregular space situated below the base of the skull. It intervenes between the lateral wall of the pharynx and the ramus of mandible. The roof of infratemporal fossa, formed by greater wing of sphenoid, separates infratemporal fossa from middle cranial fossa. Bony features of the roof includes the spine of sphenoid, foramen spinosum, foramen ovale, and infratemporal crest. The spine of sphenoid, which is also known as spina angularis, is an inferior pointing bony process which is also a site of attachment of sphenomandibular ligament, anterior ligament of malleus, and tensor palatini. It is related medially to coda tympani nerve and laterally to auriculotemporal nerve. Due to these close relations, the fracture of spine of sphenoid may lead to cessation of salivation from major salivary glands, as secretomotor fibers to salivary glands are present in these nerves. The foramen spinosum, present anterior to the spine of sphenoid, transmits middle meningeal artery and nervus spinosus. Nervus spinosus is a branch of mandibular division of trigeminal which supplies the dura mater. The foramen ovale, situated at anteromedial aspect of foramen spinosum, transmits mandibular division of trigeminal nerve, accessory meningeal artery, lesser petrosal nerve, and emissary vein. The infratemporal crest is the site of origin of upper head of lateral pterygoid. On occasions, a tiny bony opening known as foramen innominatum or foramen petrosum, which is also known as foramen Arnold, is present between foramen spinosum and foramen ovale. When present, it acts as passageway for lesser petrosal nerve into the infratemporal fossa. Another inconstant small bony opening known as foramen of Vesalius or sphenoidal emissary foramen is present between foramen ovale and foramen rotundum in the greater wing of sphenoid. When present, it acts as passageway for emissary vein which joins pterygoid plexus of veins to cavernous sinus. As this foramen can act as a potential route of spread of infection, example cavernous sinus thrombosis due to infection within orbit and paranasal sinuses, surgeons and radiologists need to be aware of its location and variations. A groove present between the greater wing of sphenoid and petrous part of temporal bone is known as sulcus tubae, which lodges the cartilaginous part of eustachian tube. So this was the first part of Norma basalis. Thank you for watching.